Hello everyone and welcome you all in the Network Student Zone. If you're a medical student and you're confused about agonist, antagonist, synergist and fixator or isometric, isotonic contraction, then don't worry, I Dr. Seda Sara is here to help you. In this part of video, I will cover the classification of muscle on the basis of group action, and this includes agonist, antagonist, synergist and fixator. But before I cover this topic, you should grasp the concept, and it's important to know the contraction in the skeletal muscle. Contraction in skeletal muscle, these are of three types. They can be reflexive, phasic and tonic. First we will cover the reflexive contraction and then later on we will move towards the other topic. So we know the skeletal muscle are voluntary muscle and their activities under the control of will of an individual. However, certain muscle contract automatically or reflexive and therefore they are not voluntarily controlled. I will give you the example of myotatic reflex, and it's also known as the stretch reflex or deep tendon reflex. In this image, deep tendon reflex is shown, and you can see in knee jerk reflex that is initiated by tapping the patellar tendon, and this results in contraction of quadricep muscle of thigh. And this results from the final effect, that is the kicking motion. Another example of this contraction is respiratory movement of diaphragm, which we all know they are controlled by the reflex generated by the levels of oxygen and the carbon dioxide in the blood, although we can willfully control it within limits. Another type of contraction is tonic contraction. You all should know that the tonic contraction is sustained low-level contraction of muscle or group of muscle over an extended period. This tonic contraction is different from phasic contraction. We will cover in detail later on. So the phasic contraction involves a short burst of contraction followed by relaxation, while the tonic contraction, they are the continuous contraction. Tonic contraction are going to play a crucial role in maintaining posture, stabilizing joint. It helps to prevent excessive movements. They also contribute towards a muscle tone. While I am talking about muscle tone, you should know what the muscle tone is. So muscle tone is slight tension that is present in muscle even when that muscle is at rest. So muscle tone, why this is needed? It's necessary for maintaining the health and the responsiveness of that muscle. And muscle tone can be absent during deep sleep or in unconscious patient, or it can be due to some nerve lesion or another medical condition that results in paralysis. Now I will tell you about phasic contraction. Phasic contraction is of two types, isotonic or isometric. There are the two types of isotonic, concentric and eccentric. The term iso means the equal and metric mean length. Therefore, in isometric contraction, muscle length remains same. So you should remember this. When the muscle length remains same, it results in static position or no movement. For example, when you are holding a plank position where the muscles are contracted to maintain the posture without any movement, the muscle tone remains same, but the length of muscle is changing. So when the length of muscle is changing, it can be either shortened or it can lengthen. Therefore, there are the two types of isotonic contraction. It can be concentric or it can be eccentric. In concentric contraction, the muscle shortens and this results in movement, while in eccentric contraction, there is a lengthening of muscle. Now I will explain it with the help of example of bicep curl exercise. When we are doing the bicep curl exercise and lifting a weight during this exercise is an example of concentric contraction because the muscle is shortening in this case, while lowering a weight during a bicep curl exercise is an example of eccentric contraction because there is muscle lengthening. In this diagram, it's explained why the length is not changed in isometric contraction. In isometric contraction, length is not changed because the resistance and the gravity, they are in balance, so no change occur. While in concentric contraction, the force is more and the gravity is less, hence the muscle shortens. While in eccentric contraction, gravity is more and the muscle force is less, hence the lengthening of the muscle occurs. That was all about the contraction of skeletal muscle. And now I will cover the last part of classification, and that's on the basis of group action. Before I move to this topic, it should be clear to all of you that whenever the muscle is performing a specific function, that rarely that muscle works alone. Instead, the muscles in our body, they are working along in coordination with that of other muscle. So some muscle, they are playing the primary role, while other are acting as in supporting players in all that case. We all know the benefits of a group work. Similarly, our muscle also know this. Why these muscle group together to perform a specific movement? They do this so that the desired movement could be produced, to control the speed and the range of movement, stabilization of joint, and to prevent the unwanted movement at other joint. So on basis of group action, the muscle can act as agonist or prime mover, antagonist, synergist, and fixator. Agonist is also called the prime mover, or this is the main muscle. You should understand this. This is the main muscle that is responsible for producing a prime movement in body. Whenever the agonist act, they contract concentrically, mean the length of muscle shortens and the desired movement is produced. While the antagonist, they are the muscle that opposes the action of the agonist. They are acting basically opposite to that of agonist. Fixators are the muscle that fixes the proximal part of limb through isometric contraction, while the movement is occurring at distal part. Now we will take the example of bicep curl exercise to understand this again. So during a bicep curl exercise, bicep brachii is agonist. Why this is agonist? Because it contracts and undergoes a concentric contraction. It shortens, and when this bicep shortens, it pulls on forearm. It causes a flexion at elbow joint and therefore lifting the weight towards the shoulder. In this example of bicep curl exercise, tricep opposes the action of bicep brachii. Hence, the tricep is antagonist. When the agonist muscle contract to perform a movement, its antagonist is going to relax. And this dynamic relationship helps in smooth movement. It also controls the range and the speed of movement and maintains the joint stability. In nutshell, muscle, once acting as an agonist in specific movement, this can be antagonist. This should be remembered by all of you. I mean, it's not necessary the muscle will always acting as an agonist, will always act as an agonist. It can act as an fixator. In other movement, it can act as an synergist as well. Now, for example, in elbow flexion, bicep brachii is agonist and the tricep is antagonist. While in extending the forearm, tricep is acting as agonist while the bicep brachii is acting as antagonist. So it's not necessary. And the fixator in this example, in elbow flexion, the fixator can be the muscle of the shoulder joint and the wrist joint, because they have to fix both these joints. And the muscles of the shoulder joint include trapezius, deltoid, sits, which are the supraspinatus, infraspinatus, teres minor, and the subscapularis. And similarly, the muscle that acts as a fixator on the wrist joint, these include the wrist extensor and flexors. Brachialis and the brachioradialis, they are synergist in this example of the bicep curl exercise, because they are assisting the bicep brachii in flexing the forearm. It's also important to know that in many locations in our body, the agonist muscle crosses the multiple joint before it reaches the joint where the main movement is going to occur. And to prevent the unwanted movement at intermediate joint, there the synergist act. They contract and they stabilize that intermediate joint. I will give you the example of the flexors and the extensor muscle of the carpus. They contract to fix the wrist joint, and this allows the long flexor and the extensors of the finger to work in a proper way. Have you ever thought why this coordination of muscle is essential? For muscle, this coordination is essential for everyday activity that we are performing, like walking, reaching, grasping object, as well as some complex movement like the sports and the physical activity also require this coordination. Now I will move towards the last part of this video, and that is the shunt and the spurt muscle, and most of the students feel confusion in these topics. The term shunt and the spurt muscle are rarely used in the anatomical discussion, but we should grasp its concept, what basically the shunt and the spurt muscle are. Spurt muscle are also called as the transaxial muscle because their proximal attachment is away from the acting joint, and their distal attachment is close to the same joint where the movement is occurring. Typically, the spurt muscle are the prime mover or agonist. I will explain you spurt muscle again with an example of an elbow joint. In elbow joint, bicep brachii is the chief spurt muscle. Why this is chief spurt muscle? Because its proximal attachment is away from elbow joint, and distally this bicep brachii is attached to the coronoid process and the ulnar tuberosity of ulnar bone. And these muscle fiber, the spurt muscle fiber, are mostly designed for the speed. Now I will tell you about shunt muscle or paraxial muscle. They are having attachment opposite to that of shunt muscle. Paraxial muscle, the proximal attachment is close to acting joint while their distal attachment is away from these joint. And normally the shunt muscle may be synergist or fixator. Again, I will explain you this with an example of elbow joint. In elbow joint, the brachioradialis is shunt muscle. Why this is shunt muscle? Because its proximal attachment is on the lateral supracondylar ridge of humerus, and this is close to the acting elbow joint, while distally this is attached to the styloid process of the radius that is away from joint. Don't forget to like, share and subscribe for my fascinating insights into amazing world of anatomy with Anatomy Student Zone.